The following is a paid program, and the views expressed do not necessarily represent the opinions of the management of this station or Pamel Broadcasting. And the views and opinions expressed by the hosts, guests, and callers of this program are solely their own. They do not represent or reflect the views, policies, or official position of ACA, its affiliates, or its staff. ACA does not endorse any statements made during this broadcast. This is 1 in 31 Autism Today, a presentation from Anderson Center for Autism. 1 in 31 Autism Today is a weekly show devoted to autism spectrum disorder.
Good morning. This is 1 in 31 Autism Today, the podcast on topics related to autism spectrum disorder. I'm your host, Eliza Bozensky, Chief Development Officer with Anderson Center for Autism. And on behalf of Anderson Center for Autism and Anderson Foundation for Autism, I want to welcome you and welcome our guest, Mariel Piña, Coordinator of Planning at the Rockland County Department of Mental Health. Welcome, Mariel. It's great to have you on the show.
Hello, great to be here. Thank you.
So Rockland County is just nearby Anderson Center, and we, I think, got to know you, or we're going to talk today at least about some work that you have done with our Anderson Center Consulting and Training Team, otherwise known as ACT. We're going to hear about the Rockland Works Career Center, and we're going to hear about the All Abilities Training Program. But before we get into all of that, I'd love for our listeners to hear a little bit more about you, your background, and how you have come to where you are today as Coordinator of Planning with Rockland County Department of Mental Health.
Sure.
So take it away.
Sure. So I'm a licensed clinical social worker by trade, I guess. I also have my CASAC for substance use therapy and interventions as well. I started on this path, I say, when I was probably about 5 years old, and my mom threw me into community service and the helping world and supporting others and things like that, and didn't have a word for it at that point. But once I got older and realized social work was kind of that, I threw myself into that and did my undergrad at Wesleyan University for sociology, and then spent some time actually in Spain teaching English, just taking a break from everything and refining my Spanish language skills so I could jump into social work, being a bilingual therapist, and then came back and did my master's at Hunter College in New York City, and then got licensed and jumped right into field work, basically case management for folks with for children with a serious emotional disturbance, going to their houses, working with their families, doing that really hands-on, one-on-one work with them in their settings, in their home settings. And then from there, I came here to the Department of Mental Health, where we had a very large outpatient clinic at the time. We served, everybody and anybody in Rockland County who needed services. I did a lot of clinical work with folks who spoke Spanish, folks who had immigrated from other countries to the United States, and did a lot of work with kids with trauma. I'm also certified in trauma-focused cognitive behavioral therapy, which really helped me in my work with the kids. And then over the years, the county decided to kind of outsource and a lot of their programs here at the county, and so our clinic closed in 2019, and we moved into more of this oversight role, which I'm in now. And so basically my role is, in a nutshell right now, is to oversee all services for the adult mental health population, as well as services for the intellectually and developmentally disabled. My work with the autism community falls somewhere in between both of those, so it's appropriate that I'm kind of oversee that, and that's where I am today. So we oversee services. We try and make sure services are efficient, but also quality, and we try and make sure everybody's getting what they need in Rockland County.
Amazing. You and I have quite a number of things in common, actually, as I was listening to you give your background. I am also a licensed social worker, master social worker, and I didn't do the LCSW, but I have the LMSW. Went to grad school in New York City, just very close by at Columbia, and also was raised in a family of, for me, it was educators, but always had the sense from when I was about 4 or 5 years old that I wanted to work with families and kids and somehow be one of the, as Mr. Rogers would put it, right, one of the helpers. Yes. And I really have always had the chance to do that. So that's awesome. I also worked as an early intervention service coordinator. straight out of grad school. So I was also in people's homes working with little ones with developmental delays. And I found that, and I'm just kind of picking up on the sense from you, even though, we're on screens with each other, but it is an incredible learning experience to have to walk, and a humbling experience to walk into somebody's home or to ask to come into somebody's home to sort of help them with their child or their foster child or their grandchild. For me anyway, I learned a lot about what they teach you in social work school, right? Starting where people are at, by doing that job. So it sounds like maybe that also put you in that position of
Absolutely.
being able to then now be a leader and sort of, deciding and helping to coordinate all the planning that goes into linking people that need services with the appropriate services. Easier said than done, right?
Right, that's for sure. It's much easier said than done. And yeah, you're right. It's a humbling experience, and especially being so young and being my kind of first job. It's always an interesting contrast when you're going into people's homes and trying to help, right? But
Exactly. I met some of the most amazing people when I was doing that. A lot of foster parents, but just people who it's just unbelievable when you knock on their door and are willing to engage with virtually a stranger that maybe they've talked to on the phone. At least back when I was doing it, was years before you, but we there was no real emails or anything. I would run back to my office and take notes in pencil, I think, something crazy like that. So very different timing, but really cool. So I'm so glad that you're in the field and that you're working locally to us in the Hudson Valley and Rockland County specifically. Let's get into how you connected with Anderson Center Consulting and Training, which is, part of Anderson's organization, and their focus is primarily consulting with and providing training for various types of providers, everything from school districts to services in homes with families to, training businesses of all types to be autism supportive. What did the county do with ACT, and did it have an impact?
Yeah. So we have a saying that we don't reinvent the wheel. And we heard that Dutchess County had done a phenomenal job with their autism supportive environments and reaching out, and their contract with ACT, and just all that they've done in Dutchess in general through the Think Differently campaign that they began there. So we didn't reinvent the wheel, and we started our own Think Differently campaign in Rockland County, actually. And so another department, the Office for People with Disabilities, had kind of started that campaign, and we jumped on board. And when we often talk between our Hudson Valley, the region really, and our counterparts at other counties, and had heard from my Dutchess County counterpart about the ACT, the training and consulting there through ACT, and we thought that it would be a great idea. We really wanted to expand the knowledge and awareness about autism and neurodivergences in general in Rockland County. We felt like that was an area and a population that really doesn't get touched upon enough. It's kind of like I said at the beginning, it really kind of falls a lot of times in between the mental health and the intellectually and developmentally disabled. It doesn't have a nice clean cut place for folks like that. And so we wanted to expand awareness across the board about that, whether it be in our departments, whether it be in workforce, whether it be businesses, whatever it was. And so ACT seemed like the perfect place to start, really, doing that. So So far has it provided training in your offices? Have they provided training in businesses in the county? Bring us up to speed in terms of where you're at with that. So they have provided numerous trainings to mainly our department. We decided our departments, county departments, we decided to start kind of in that way, just to kind of show the rest of the county that if the county departments are on board and doing this and investing their time into this training, then, eventually other people will jump on board too. So we have trained so far within the county departments. We've trained some of our probation department. We've trained our social services department, not quite all of them, but they will be training all 350 employees hopefully by the end of summer will be trained. Our law department has been trained, part of our sheriff's department and corrections department. A few of our local police departments have sent folks as well, officers. And then we have a training for our personnel department, as well as our tourism and economic development department. So a lot.
Amazing. Great.
Yeah.
That's fantastic. And you're hitting so many different areas where the need is so great. First responders, they do such a phenomenal job and such an important job, but they have to make such split decisions in so little time to keep everyone around them and themselves safe and everybody they're, interacting with in the community. The idea of first responder training, I think, is one of our, top of our list in terms of who we want to train. But you're also going all the way to personnel, which to me gives me a little inkling that maybe Rockland County is also sometimes open to employing people who are neurodivergent and autistic. And that's amazing in terms of being able to know how to create an environment that's welcoming to and inclusive of so many excellent adults who are looking for work when you're hiring, as opposed to sort of being like, we don't know how to do that. That's one of the things ACT does really well. And then everything in between. Has the experience been positive so far? It sounds like
absolutely. It definitely has been. More and more departments are jumping on board, like I mentioned, and we've also, besides just our county departments, one of the other ones I want to highlight, and we'll talk about Rockland Works also, but is Montefiore Nyack Hospital.
Yes.
They have also jumped fully on board with this and have had ACT come multiple times a month to their orientations to get all of their staff, from security guards to doctors, physicians, surgeons, trained through this program, because we also know that everybody has to go to the doctor, and so they've not only has the hospital done it, but also their outpatient practice called Highland Medical. They've all been trained as well.
Amazing. And you're absolutely right. Everybody has to go to the doctor, and doctors receive, and nurses and all the medical personnel all over, receive an incredible amount of training and education. And they are starting to get more and more training on working with behaviorally complex neurodivergent individuals. But it's one training in medical school is not the same as an ongoing sort of reminder, also from an expert who's not a physician, who's coming in saying, look, from the real world of just being, a neurodivergent individual or working with a family, these are some simple things. And I think that's a nice approach that ACT takes is, whenever I've sat through a training with them or observed them training or talked to people who received the training, it tends to be very easy to take in and to digest. These are simple, sort of often small things that you can change about one's demeanor or one's environment that don't cost a lot of money, but really make a world of difference to the people coming through your doors. So I love that you're embracing it so beautifully. We're going to take a short break. When we come back, we're going to get into Rockland Works Career Center and the All Abilities Training Program and all the other cool stuff going on in Rockland County. This is 1 in 31, the weekly podcast on topics associated with autism spectrum disorder. I'm your host, Eliza Bozensky, and we'll be right back.
To every referee, umpire, and judge in high school sports, we want to say, we see you.
We see everything you do for us that goes unnoticed.
We see the positive role models that you are.
We see the way you get unfairly criticized just for doing your job.
The truth is, we couldn't play without you.
So thank you for investing your time in us.
Thank you for protecting the integrity of the game, no matter what.
We hope you always know how much we appreciate you.
Because without you, this is just recess. It's not really a game.
Thank you for always making it possible for us to play the sports we love.
Want to serve the students in your community? Sign up to become an official in New York at highschoolofficials.com.
I'm Angela Bassett. As a first responder on screen, I know what it means to act fast in an emergency. In real life, the same urgency can save lives, especially when it comes to food allergy. For 33 million Americans, one bite can cause a life-threatening reaction. Now, there's a needle-free option, a new way to carry epinephrine. Know the risk, know the options. Be ready to act. Learn more at foodallergy.org/ready-to-act.
And now, 1 in 31, Autism Today, continues on 100.7 WHUD. This is a weekly community affairs presentation from the Anderson Center for Autism.
Welcome back to 1 in 31 Autism Today, your podcast on topics related to autism spectrum disorder. I'm your host, Eliza Bozensky, and I'm talking with Mariel Piña, Coordinator of Planning with Rockland County Department of Mental Health. Mariel, it's been just a really fun conversation so far. We've covered your background, very similar to my background, so that's kind of fun, but also your role with the Rockland County Department of Mental Health, your recent training with Anderson Center Consulting and Training, otherwise known as ACT, who are obviously making a big impact. The ACT impact. I don't know if that's funny or not, but that's really their goal is to broaden out the expertise that we have here at Anderson out into the broader community. People that come here and live with us and are educated here in our school program or living in our adult program, or scholars from around the world in our international program, they come frequently to us, and we have for years wanted to bring this level of expertise that we've developed here by nature of just solely working with autistic individuals out into the community. So what you're talking about is the scale that we get very excited about, because you embraced it, and now it's spreading throughout Rockland County, which is just awesome. Why don't you tell us about, it's up to you, Rockland Works Career Center or the All Abilities Training Program? You can start wherever you'd like.
Sure. I mean, it's all kind of intertwined. So the All Abilities training program is kind of just what we've named this training for Rockland County. And so it consists of the four different trainings that the ACT ACT can do. So we have the first responders, healthcare, employment, and environment, right? So we've done the first responders, we've done the healthcare, that's for sure. And then what we're trying to branch out more is for employment, businesses around Rockland County. And one of those is Rockland Works, and that kind of falls into both our employment as well as the environment, the autism supportive environment trainings. Rockland Works is a one-stop employment and training resource for job seekers and people and employers looking to staff positions that they may have. And that could be anything from a trade to just anything, hospitality and office building, whatever you may be interested in, IT, things like that. It's a really great resource for Rockland for both really young folks right out of high school, or maybe who haven't completed high school but have done a GED, to 100 years old if you want a job, I guess, and you want to get trained in something new. But it is mostly free. Almost all of their courses are free to sign up for. You do an orientation, and then you can choose your path. They will pay for trade school in many cases as well. And it's just a really great resource for Rockland residents who are looking for jobs, maybe a change in career a little bit later on in life, whatever it is. And so they approached us looking to get trained in this, not only for their staff to understand folks that may be coming in and participating in their courses and things like that, but also to help employers understand how folks with autism or a neurodivergence could be a vital part of their employee teams. It really, when we first kind of started working with ACT, Kathleen Marshall from the team mentioned something that really stuck with me, that is that folks with autism or a neurodivergence are oftentimes the largest pool of unemployed workers really that we have out there, and sometimes some of the best that we have.
Very conscientious, very loyal, very
absolutely
often want to follow rules to the T and on time, and a lot of excellent people, excellent qualities. Yeah,
exactly. So we were really excited about the partnership with Rockland Works, and we hope it can only expand. Again, we train their staff, which is not a huge staff, but it's about 10 to 12 people that they have on staff there. Got them trained, staffed up, and now they're helping us spread the word across to all of the businesses that they work with, to hope to get some of those businesses and the administration from those businesses on board to take the training as well, so they can see the benefits of having of opening up their employment pool, really.
Absolutely. I think, you really hit the nail on the head. I think that it's, again, just more good news. I'm getting excited about Rockland County right now. You're doing a lot of good stuff. But it is, especially when it comes to employment, but also, education, college, even first responders, it's never one side of the equation. It's always got to be both sides of the equation. But in the employment piece, helping individuals, neurodivergent individuals, get where they need to get and get through an interview successfully. Practice for an interview, not just the questions that are going to get asked, but how to respond to one that you don't see coming, which can sort of throw somebody off, especially if you're really sort of a routine-based, that's your comfort zone kind of person. But then on the other side is also educating and training those employers about the fact that you can employ people who are neurodivergent. You can do it. I think that what Kathleen is, at least I know Kathleen well, she's fabulous. One of the things I've learned from her and her team is really that it's not always, in fact, it's not often a sense of I don't want to. Often it's a sense of we don't want to let this person down. We don't know how to employ or support somebody who's neurodivergent or autistic. And that's different than I don't want to. But if you don't talk about it, if you don't create a forum and a platform to discuss and be open about, I don't know how to do this. I don't know what to do if somebody says, can I wear headphones at work? Or can I have a job where I can take breaks of making eye contact with people every hour? Whatever, I'm making stuff up. But like any number of things, once you get it out on the table about what's really the questions are, then it becomes much easier to help, either the employer or the potential employee or both get, sort of meet each other in the middle. And I think that's what I love about Anderson Center Consulting and Training is that they're very adept at both sides of the equation. And they have a really great way of explaining things. Yes. So give me an idea of some sort of, outcome of this so far, because I know it's relatively new, but an outcome that you've seen that really brings a smile to your face, something that you're like, yes, I know this was a good thing because I just saw that interaction happen, or I heard this from somebody I know.
Right. So I think, another thing that ACT offers that we took advantage of were the sensory kits. Right? They're these just simple bags that have all of these different tools in them that can be really helpful for anybody, right? And a couple, just two of the highlights of those things were, one, we have been slowly getting them out to all of our police departments, and they are so positive and responsive, where we thought, they're just going to stick them in a corner. Honestly, right? We thought they're going to stick them in a corner, they're going to get dust on them and never use them. But they have confirmed that they are putting them in as many squad cars as we'll give them bags for. And we even had one instance where an officer reached out. We tend to have contact with them for other things, and mentioned that he was glad that he had it because there was an instant where they had a child with autism that they had to respond to something for, and they were able to pull it out, and it helped them build a relationship with that child because they had these little tools to give them and like fidget things for the child to use. So that really was like, okay, we bought all these kits and it's actually, they're being used and making a difference, which is amazing.
Very traumatic experience for anybody interacting with law enforcement for any reason. If it's not, a life-threatening situation. But that, I love that you use that as an example, because so many times what we hear and what ACT comes back with their own experiences, it really is often a small thing, a simple thing, having a set of headphones because the sirens are too loud. And once you're the person who's offering a child or an individual with autism the thing that they need in the moment, you're often just in. I mean, that That's relationship is there because you helped them solve for something that was really overwhelming. And also, obviously, then you're having a positive impact in your neighborhood and the community, the family of that individual. It can really de-escalate a situation that otherwise could get pretty intense pretty quickly. So that's wonderful to hear. We only have a couple minutes. I want to give you time if there's anything coming up in Rockland County, with your departments that you oversee, or anything that you want people to be aware of. Is there anybody visiting Rockland County or coming maybe to live there that you want people to be aware of in terms of resources? Anything? Last 2 minutes.
Sure. I mean, again, we would love if any businesses are listening. We would love to get you trained in these, in any of these trainings that you're willing to send your staff to, for sure. And other than that, be on the lookout for our Chalk the Walk campaign against stigma, and breaking down stigma against suicide, and just talking about those things. So Chalk the Walk and let's talk.
I love it. I love it. You have a hard job and you do it with a smile and a positive attitude. And I think you're absolutely right. Talking about things that for so many years have just been unspoken or we don't want to because it's uncomfortable. It's the uncomfortable stuff that we really have to talk about. And then all of a sudden it becomes less uncomfortable. It's this amazing thing that happens. I thank you so much, Mariel Piña, Coordinator of Planning for Rockland County Department of Mental Health. Thanks for your time today and for all your insights. And I echo what you're saying. Anybody out there in Rockland County who wants to take advantage of the ACT trainings through Anderson Center Consulting and Training, please do and get in touch with Mariel.
Right, thank you.
All right. This is 1 in 31, the weekly talk show on topics related to autism spectrum disorder. I'm your host, Eliza Bozensky. And remember, Anderson cares.
You've been listening to 1 in 31, Autism Today, a weekly presentation from Anderson Center for Autism. Join them for another edition of the show next weekend.